I did struggle with it. I had I was a sugar addict to start off with. There's a lot of alcoholism in my family, so my option was always to do the sugar, and which converts to all of that anyway. But
Yeah.
uh, so that was a big deal, and getting off the sugar, is a big deal. Um, Finding out that the things that I thought were bothering me before, as far as acids, with just tomatoes and fruits and things like that, I'm not having that problem anymore either. My weight has been just steadily decreasing, and I'm really not doing, I mean, outside of the dieting part of it and the normal things I do, walk the dog or whatever, it hasn't been that much. But the weight loss has been incredible. It's my everything is starting to get like really loose, and in some cases I have to keep pulling up. So that's been something different. And then it's like new clothes, maybe. I don't know.
Oh yeah, always. I can help you with that too. Oh my goodness, I love shopping. You let me know, but now I can help.
Me too, unfortunately. But I think overall that I feel more awake than I have before too. So that's, I feel like I'm more present, but put it that way. I don't feel like I'm so slugged out all the time,
Right.
which I really,
Yes.
yeah, I would get up in the morning and feel just as tired as I was before I went to bed at night. So that's been pretty good and stuff. So yeah, like I said, when it was in the 240s, that was just absolutely put me over the edge. I just thought I'd never seen anything like that. But I have gone through hysterectomy, and I was on radiation treatment. So I knew that probably the sugar was being affected by that, perhaps. So but still, even with that, I couldn't get it down. I just couldn't get it down. And of course, I wasn't eating anything different, so I thought I was doing fine. But it was a lot of the sugar, I think, and things like that. So now it's just every time I look at it, it's just no. This is the lowest I've seen it so far. 89. That's really impressive. Yeah, I just never. Even when I was at my worst with eating and things like that, it was never. It was never more. I think that the highest I ever saw it was like 150 something, and that freaked me out.
Yeah.
But it was never more than that. And then all of a sudden to go to 240, and I hadn't taken my sugar since I had the operation. So I think that if I had taken it all along, I would have known at least what was going on. But to
Right.
see it when I decided to take it, and I think it was after talking to Dr. Spages, I figured, well, I better start looking at it and everything. And then I saw how high it was, and it was just no, this is not going to work. I did. I actually talked to somebody last night, a friend whose husband has fatty liver, like me, and I told her what I was doing, what the protocol is, how I started off, and now that I'm in the second phase of it, and that it has changed how I think and what I do. Now I don't know what he's doing outside of. She just said that he has an egg and two sausages in the morning for breakfast. So I don't know what the rest of his day is
Right.
like or whatever. But but they were all encouraged because they saw the weight loss. That's always what strikes everybody first.
Right.
And they said, "Well, what are you doing?" And I said, "Well, I'm on this protocol, the Dr. Spages and stuff." And so I don't know where that leads to or whatever. But I think that anyone who's dealing with it and would ask, I would be more than happy to let them know, what we're doing and how we're doing and who to contact for that.